It is a critical time for healthcare workers around the world. They are on the front lines fighting a pandemic, one that has claimed countless lives. Hospital staff is working non-stop under tremendous pressure with low levels of equipment and with ICUs overflowing. So what is it like being inside a hospital? Some would describe it as a war zone. Here is a special report from New York City.
It is apocalyptic inside most of the New York hospitals. Amid the growing desperation, there are people out on the streets demanding that the lockdown restrictions be ended. But what about these medical workers? The untimely easing of the lockdown could lead to an unprecedented surge in the number of cases and fatalities. The United States has more cases than the next 6 countries combined. A respiratory therapist, David Carr, working in a hospital in New York, shows us a glimpse of life inside a medical facility treating COVID-19 patients. It's the relentless pace of the intensive care unit treating patients with COVID-19 that makes Carr keep shuttling constantly from room to room.
I don't watch the news about COVID really because I'm living it at work. I mean, you know, I go in and out of COVID patients' rooms all day. That's basically what is going on at the hospital right now. Everybody is COVID, and I see the worst of it.
In these testing times, healthcare workers are looking out for each other. Carr says their kindness for each other is what keeps them going. Not just doctors and nurses, but all the essential services workers who are contributing in their own way to help the people in need.
Our work is very important. All of our work at Sinai, and in every hospital, and every bus driver, and every garbage man, and cop, and fireman, and cleaner, and restaurant person, all of our work is really incredibly important.
New York City has been at the epicenter of the global coronavirus pandemic, not just in the United States, but in the world. While the city's funeral homes have been overwhelmed, the staff is hopeful that the virus has peaked and the worst days are over.
So it's the end of my day. It was pretty busy, but still doable. And the workload is still, it's still good. And this thing is still going on, even though the numbers have gotten better. And it's gotten better here. We're discharging some patients. But, I'm still alive, still in here. I'm working tomorrow. And thanks for coming to my world for a couple of days. All right.